Well, it's day 1601, 1601 days of the sabotage that started 1601 days ago by Dr. Suporn with Tanya Sokol as a patient under his care. Um, I I don't know what to say. This is the daily videos. I'm upset that um, I'm upset that I've had to go through this, and that Dr. Suporn hasn't been any help, hasn't come forward with what he's done. So I'm just trying to come to grips with that, and it's really hard to fathom what I've had to go through just to tell my story and try to get help. So I'm here trying to get help, and it's 601 days, and I'm still suffering from what I believe is a embalming fluid, oil-based, that Dr. Suporn injected into me on day 9 post-op. I think I've shown that my groin has symptoms consistent with embalming, and I don't know exactly how it became embalmed, I know Dr. Suporn was involved. I don't know what exactly was used on me. So, I mean, how do you do that? That doesn't seem right that I could be injected with something like a formaldehyde or embalming fluid without becoming aware of it. I can only say I was day 9 post-op, still a lot of pain in my groin, in my surgical result. I suppose I would feel a needle prick in my tissues down there. I may not have felt it because of the swelling, and I don't know the answer to that. I know there was a lot of people in the room, 6 people. Six people. 2 people removing sutures. Dr. Suporn, his nurse that hands him syringes and stuff, and a staff assistant, I believe A. So that was and me. So that was 6 people in a very small room. And after that office visit, Dr. Suporn made a gesture at the end of the office visit. It was just me and him, and I was getting up from my, or he was checking something. He was behind me, and he grabbed my arm, and he grabbed it with his hand, like he grabbed it like that, and I looked up at him because he was squeezing my forearm. And I looked up at him, and he did a little grin, like that, like a pathetic kind of grin, like something was up. And I made a note of that in my notes somewhere. If I didn't write it down, I definitely remember saying something to somebody about the fact that Dr. Suporn smiled and I hadn't seen him smile before, and he usually doesn't smile. So I forgot what I was saying, but thinking about that as time went by, as I started becoming aware of what Dr. Suporn had done to me, I started thinking about, well, could could somebody else, maybe the nurse, or could somebody else have, switched a syringe or did something to hurt me without Dr. Suporn knowing? And I keep coming back to this gesture, a little grin that didn't really make sense and caused a jog in my mind about what it meant. And this was after the office visit, and I believe he was grinning because he knew what he had done, and he possibly was thinking back to my email, the email I sent the day before, where I was joking about being a cross-dresser, donating my genitals to research. So if he injected me with formaldehyde or embalming fluid, knowing that it would immediately embalm my genitalia within a matter of days and weeks, without any possible recourse to get help, he very well wanted me to see him grin, and he squeezed my arm so that I would look up at him, and he squeezed my arm. I don't know what I don't know the sociological meaning of squeezing someone's arm, but I took that to mean it was a signal I needed to look up at him. Yeah, and I don't know the basis for that kind of human interaction, but I'm 47 now. I was 43 years old at the time. I'm not an abnormal human being, and I've had some rather success in my life, and I would like to think that I can understand basic human interaction. But anyways, if you don't consider that message as an indication that Dr. Suporn was behind this, consider that I attempted to get his help. I showed him my groin. I continued to get his help. I flew back at 6 months post-op, and he wouldn't order tests. He said everything was normal, that I worried too much, and then he recused himself from my care, and then he lied about it in the medical records. So he falsified medical records, just so it would look like I left him, and he could cover up his tracks. So a lot of things are happening, and I'm going to be talking about those things in depth, because I haven't been able to do so since. So or do so in the effort to get the evidence, the hard evidence, which I put forward. So I'm going to shift gears a little bit, and did Dr. Suporn sabotage my surgery? And I'm asking that because I've put forth this evidence, these videos and pictures and stuff, and some of you maybe a lot of you have seen that and um, have formed a conclusion. And I personally feel it's enough evidence to cause at least, if not someone to come to the conclusion I have, to ask questions and want to get more information, more tests, concrete tests, like a tissue biopsy or Doppler ultrasound. So I'm asking you, did Dr. Suporn sabotage my surgery? Do you think I've proven the case over the last few months? And if he did, why do you think he did so? Do you think sabotage is okay? Um, do you think injecting formaldehyde or embalming fluid is okay by a doctor, for whatever reason? Is there a reason out there that makes it okay for that to happen? And um, if it's not okay, then what should happen to Dr. Suporn, who has very good skill in performing surgeries, especially when the transgender community is needing his help to have successful outcomes, successful surgery, provided he doesn't, sabotage his work afterwards because for some other reason that the patient's unaware of, um, and reasons that he agrees with that he isn't sharing. I haven't been able to talk to Dr. Suporn. Um, I I come from a disciplinary upbringing. Someone disrespects me, I back off. I stop trying to, get their help. I stop trying to badger them if they make it clear that they don't want to have anything to do with me. So that's part of the reason why I'm not seeking Dr. Suporn's help. I spent 6 months trying to do that, and he recused himself from my care. So, so if Dr. Suporn sabotaged my surgery, did he do it out of retaliation? Um, uh, did he do it because I disrespected uh, members of his post-op following? Um, is it okay to retaliate for those reasons in Thailand? Uh, I don't know what the rules are in Thailand. Definitely anything goes as far as the justice system, in my mind, although I don't have any experience personally with it. I've read about it. There's definitely books out there. There's some names that I can't remember, but there's definitely books out there that talk about. I think there's a guy named Gore, a young kid who's doing some time for some petty drug related stuff. But yeah, the justice system is is not fair, at least compared to Western civilization, Western cultures. Um, so I haven't had this feeling of going back and trying to um, uh, take anyone to court over there. I've heard about some defamation defamation crimes that I could be um, imprisoned for, and I don't trust the justice system in Thailand to treat me fairly, to give me a chance to uh, show what Dr. Suporn did to me before they would, quash me away into a prison before I could tell anyone about it. So um, I don't think sabotage is okay. I don't think it is. I don't think. I definitely don't think you should do it in retaliation. I don't think you should read patients' emails without their consent or knowledge. Um, that's definitely a possibility in my case, considering the timing between day 8 and day 9. When I sent the email, and the next day where the complications began. Day 9 office visit isn't in the medical record, so that's another indication that something bad happened that no one wants to talk about. Um, so what happened in Thailand? Well, first, day 9 post-op, Dr. Suporn sabotaged my surgery, and then he lied about it, saying everything was normal, and saying that I was worrying too much. So by doing that, he made me feel like I was being disrespectful just by asking what was going on. Third, he threatened to wash his hands if I sought a second opinion. And he said that I could only get a second opinion after 6 months. So I went home, the United States, and I immediately got a um, uh, gynecologist to look at my problem, and I didn't tell Dr. Suporn I was doing that, and the gynecologist wanted to know if she could get their records from Dr. Suporn, and I couldn't do that. I was afraid of Dr. Suporn washing his hands of me, and so at 6 months I flew back. I flew back all the way to Thailand to let him look at me, and he wouldn't order tests to rule out formaldehyde. I asked for that. I explained to him why I thought formaldehyde could have been injected into me, and I I also disclaimed that with the notion that it could have been an accident. Dr. Suporn didn't appreciate that anyways, and he recused himself from my care. So at 6 months, he recused himself from my care, and then in the medical records he indicated that I left him and that he didn't leave me. So he falsified medical records. Based on the length of time that the tissue has taken to deteriorate, and the spreading toxicity of the or continued spreading of toxicity of the embalming fluid in my groin, I've come to the conclusion that it has to be oil based, because if it was water based, water soluble, my body would have absorbed it by now, it wouldn't continue to spread. And I've done some research out there, and I believe formaldehyde can be uh, diluted in an oil substrate or oil medium. And I believe that cedar oil is a embalming fluid that is oil based. Um, yeah, cedar oil. So yeah, oil based, and it was used by the Egyptians many years ago. So if Dr. Suporn used this oil based embalming fluid, and knowing that it would continue to harm me months and years after his exposing me to it, then I believe that goes beyond the initial sabotage, the initial sabotage that he was subjecting me to. So that's why I feel I need medical attention immediately, as soon as possible, because this toxicity continues to spread, and until the tissue is removed, my groin tissue is removed, I'll continually get worse. So that's another side of the story. Is I ultimately need somebody to remove my groin. I can't cross my legs. I have to sleep with a pillow between my legs. I can barely walk. When I bend down or sit down, my groin feels like it's being ripped off my body. Yeah, so it's not a pretty picture, and I don't think that's acceptable, even if if you're a doctor and you have whatever reason you can think of to hurt somebody. I don't think this is acceptable. So even if he wanted to keep me from becoming a woman, a functioning woman, I don't think it's okay to let me continue to suffer 4 years, and I'm every day I'm trying to get help. I'm trying to move on, and I can't. I'm in a perpetual day 9 post-op sex change. I haven't gotten past day 9. I can't cross my legs. I can barely sit. I can't sit down. I have to use my arms to position me down lower on a seat. So I just think that's incredibly mean, and somebody that shouldn't be practicing medicine. I don't think he should be practicing medicine based on that alone. The sixth item on here that I went through went through in Thailand was Dr. Suporn took measures to hide the evidence of the sabotage. So he sabotaged me. He might have said something like, Stephanie, we're going to, what's the word for numbing tissue? Anesthetic. We're going to inject an anesthetic into your urethra so we can take stitches out. So I know he said he was going to take stitches out of my urethra, and maybe do something else that I probably didn't really understand, a medical term, but I remember the urethra and taking sutures out or stitches out of the urethra, and I don't know if he said he was going to anesthetize the area first, but if he did do that, that would have been the chance. That would have been the opportunity to um, inject a fluid in there, something that's very diluted. That straight on formaldehyde, you'd feel a sting. You'd know something was up. Something that was diluted that would take a few days. In my case, it took about um, well, one day. It took one day, and then 3 days to see tissue exudation, which is yellowness and yellow fluid in surrounding tissues. But what did he do to hide the evidence? He removed on day 16 post-op, which was a week after the Friday meeting on the 9th of on the 31st of July was a Friday, and then on the 6th of or 7th of August, there was a office vaginal canal exam in his office on Friday, outpatient office, same office where the day 9 outpatient office visit was. So day 9 post-op, I was the sabotage, and day 16 post-op is when there was a vaginal canal exam, and during that exam, it was a long exam, and there was a table with long forceps, about this long, sitting on a table, and there was a mirror. Now, the reason I think that Dr. Supran was doing something nefarious was because they wouldn't let me have the mirror to look to see what was going on. I said, can I see what was going on? And when I reached over to grab the mirror, I remember bringing the mirror. I was getting the mirror off the counter. I looked over there, could see it, and Sin, one of the assistants, Sin is her name, Cin, snatched the mirror out of my hand and wouldn't let me have it back, and wouldn't explain to me, wouldn't even look at me. So looked like somebody that was very upset with me and didn't want me to see what was going on. And so Dr. Supran removed exudated tissue, which is the last remains, last visible sign of a acute toxic exposure to a tissue preservative like formaldehyde or diluted formaldehyde. If you look at the material safety data sheet for formaldehyde, tanning of the tissues, if you look at subcutaneous injection symptoms, one of the symptoms is extreme exudation of the tissues. So what happens is the tissues start excreting a yellow fluid into surrounding tissues, and that's the sign that's one of the signs of being exposed subcutaneously with formaldehyde. So it's called a material safety data sheet, and you can find it in there. So I have photos on Flickr that show day 13 post-op, a few days before day 16 post-op, where there's a lot of yellow tissue and a lot of yellow excretions from the vulva. So if you want to go look, you can go look at it. And another piece of evidence, another sign he was trying to hide evidence is on day 13 post-op, which was a Tuesday, August 1st, 2nd, 3rd, August 4th, Tuesday, August 4th, 2009. It was either Tuesday or Wednesday. I got scared in the middle of the night, and I packed my suitcase, and I went down to the front desk, um, and asked them if they could call a ambulance from uh, Pattaya Hospital. Pattaya Hospital. So she calls the ambulance and lets me talk to the ambulance people, and I say, yeah, I am not feeling well, and I'd like to go to Pattaya Hospital. And they ask me where I'm at. I give the phone to the clerk, and she says, I don't know what she says. She's talking in Thai, but I tell her to call for the ambulance and give the ambulance the directions for getting to the hotel. And so she says some things in Thai, hangs the phone up, and in about 10 minutes, the one of Dr. Suporn's staff comes by and asks me what I'm doing. And long story short, the clerk had turned the ambulance around and called the Suporn clinic to advise them what I was trying to do. That I was trying to get I was trying to go to another hospital. So I think there was an attempt to keep me from getting to getting a second opinion when the acute symptoms of the complications were still present. So the acute symptoms being the extreme exudation of the tissues in my vulva, vaginal canal, and and vulva and vaginal canal. So so that's what I went through. There's a couple other things that happened that were kind of weird that I won't go into now, because they're kind of just kind of frivolous, but very unnerving kind of things that happened that make you scratch your head. So I'm extremely upset that the possibility that a doctor is sabotaging his work, is going through this whole effort to not let anyone find out about it, and put the patient in a position where they look stupid for a long period of time, because what they're proclaiming is happening is being denied by this doctor, and is not being dealt with by other doctors because it's so outrageously so outrageous and unprecedented. So it's been a huge turmoil in my life, and I want some answers. I think I deserve some answers. So this is day 1601 of Sex Change Sabotage, and I want to hear from you. What do you want to know about what? Do you want to see my email? That I sent the day before. Isn't what I'm going through a reflection of that email? Isn't that what Dr. Suporn decided to do? He wanted to hurt me. I disrespected his post-op following. He found my emails. I gave him an excuse to hurt me. He did it, and now he probably wishes he hadn't. The transgender community has covered this up from since day one. And that's part of the reason I wasn't able to get help as well. Um, and anyway, I'm gonna let it go there, and I just I just I just want someone out there to think what it's like to be what it might be like to be in my shoes, and how much do I need to suffer, uh, and I really didn't do anything to deserve this. I'm sorry I hurt someone's feelings in the transgender community, but I was speaking my mind. I felt people were acting inappropriately towards me at the time. I can get into that in another video. I think there's a big kind of misunderstanding as far as the transgender community and what the participants are, how they behave in that community, and the types of participants in that community. You know what their goals are, and what they see as their day-to-day um, their day-to-day outlook on life. It's different. You have you have a division in the community that there's no communication across based on certain things. So I think that's part of this. I think it's someone not able to handle an argument, and wanting to possibly wanting to retaliate. So I'm going to let it go there, and this is day 1601. So if you're out there, if you're a doctor, step forward and end this misery that I'm going through. Okay, thanks.